I'm Dr. Evan, a veterinarian in this video. There are many ethical dilemmas in veterinary medicine, but a major one in companion animal medicine is euthanasia. It is likely the hardest decision you will have to make about your pet because you don't want to euthanize your pet before their time, but you don't want to wait too long and have them suffer. Finding a medium between the two would be the most humane option, but is rarely so black and white. In this video, we will look at two different situations where pet owners weigh euthanizing their animal or going with treatment options. Hopefully these clips can help you better understand and decide if euthanasia is the correct decision to make.
Hello, Dr. Evan. My dog here isn't doing so great. He's gotten really old and I'm nervous that he's at the end of his life and, just not acting like himself anymore. I was wondering if you'd be able to come out to my place and look him over for me. Thank you so much for coming, Doc. This is hard for me to see him like this. For some reason, he isn't using his back leg as much as I remember he used to. He would be running all over the place just like a couple months ago, and I don't know what's wrong with him, but he hasn't been eating, and that's just really worrisome for me because when they don't eat, then they don't feel good. And yeah, he hasn't been drinking either, which means he hasn't been going to the bathroom. And, I guess I just want your advice on what to do and kind of help him as much as possible,
Mm-hmm. And he is getting to that older age, right?
Yeah, he is 9 years old. He's an old dog.
Mm-hmm. I could see when I came in, his back legs weren't as good as they used to be, and he used to be a very energetic dog, and you said he's more lethargic now, right?
Right, right.
And the not eating bit, that's kind of concerning also. Have you tried giving him any people food or anything that's more palatable?
Not that I've tried.
Mm-hmm.
Not yet.
Has he been going for walks at all, or?
No, recently he hasn't had enough energy to go.
Mm-hmm.
Yeah.
Okay. So since he is getting that older age, euthanasia plans are something that you want to start organizing.
Okay.
Not saying that now is the time, but someday it will eventually be that time.
Right.
I can give you some pain meds right now for his back legs and everything, and I'll give you a couple days to kind of try to get him back on track, get him back to his usual self. Try to get him eating. You can give him people food if that'll work.
Mm-hmm.
Sometimes sweet potato is good.
Okay.
But other than that, definitely keep me up to date in the next couple days, and we'll just go from there.
Okay. Great. We appreciate it.
Mm-hmm.
Yeah.
Of course.
Thank you so much, Doctor.
Alright, so after looking him over and seeing how he's acting now, it doesn't look like he's getting any better. In fact, it looks like he's gotten worse since the last couple of days since I've seen you. So, you said you had some questions. If you want to go over those right now, I can do my best to answer them.
Yeah. So my first one would have to be just kind of thinking through if this is really the decision I want to make now, or if his quality of life just isn't going to be great. Do I wait or just do it now? That's really what I'm stuck on, and kind of what euthanasia consists of.
Mm-hmm. From what I can see, it doesn't look like he's been getting any better. In fact, like I said, he's getting worse, and I'm sure you've seen that too. But just so you know, it is important to realize a lot of people tell me that they regret waiting too long, or they feel guilty about euthanizing too late instead of euthanizing too early.
Yeah. Oh, poor guy. Yeah. So what would you say is the best way for me to say goodbye then?
So the procedure itself is actually pretty quick. I'll give him 2 shots. One will be sedation, and after that he'll kind of be out of it, not really himself. And then after that I'll give him a euthanasia solution injection. And so that will be the thing that stops his heart, and that'll happen within seconds.
Okay, gotcha.
So if you do wish to do it tonight, I can actually head out. I brought this stuff with me. If you want to take some time to say goodbye, you can do that now. If you have anybody that'd like to be here also, possibly.
Yeah, my husband and I talked about we have other dogs in the house, and we would like for them to get the chance to say goodbye too. It's a pretty special dog for us. And so what are your thoughts on having other animals present in the house with us?
So I have had other animals present for euthanasia procedures, but every animal's different. Death is a normal part of an animal's life, so they do realize that, but they cope with death in a different way than we do.
Right.
So they can pick up on your stress in the procedure, so if you're emotionally responding to this, then they can also respond in a different way. Also, sometimes after seeing like a dead partner or a dead friend, they can do different things that wouldn't be normal to us, but it's normal to them, and that can be from sniffing or like pawing at them to actually urinating and defecating on them. So that can be something that really throws people off also.
Okay.
So that would be completely up to you. I'm not against it, not for it, whichever one you personally prefer.
Okay.
Kids are another tricky one. It can be good. It can teach them valuable life lessons in the end and responsibility, but also if they're at a certain age, they might not understand what's going on. So if you do choose to have them present, again, I'm not for or against it,
Okay.
personally up to you. But if you do have them decide to be there, just make sure you explain what's going to go on before. Try to use simple terms. Instead of like put to sleep, say that his life will end if I give him a shot.
Okay.
And then after that, you won't have him anymore.
Yeah. So it's kind of like it's like a magic drug that allows him to rest peacefully. Yeah, there are many ways to say that to a kid. I guess you're right. Well, I think I'd rather just do it now.
Okay.
I'd rather, be able to say goodbye one last time and effectively, let him sleep for good.
Alright, then I will run out real quick. I'll give you some time, and then we'll be back in shortly.
Okay, thank you.
Hey, Dr. Sarah, just bringing in Snow for her appointment to see what happened with her test.
Great, yeah, thanks for coming in. Yeah, I did get those results back, and unfortunately, the mass in her mouth did test positive as cancer. So there are a couple options that you have with that. You could choose to treat, which would involve surgery to get it removed, and then several follow-up appointments of chemotherapy.
Okay,
Or you could choose to euthanize.
okay. What would the treatment be like the time commitment and the cost?
Yes, the surgery is definitely pretty costly, and since you have to keep coming in for more appointments, that would add up too. And it would require some time commitment from you as well, as she would need to have medications given several times a day,
Okay,
and also being brought in for appointments.
okay. I don't know if I have the time for that. I work full-time.
And that's perfectly understandable. You need to continue to do your job, and it's not reasonable to provide full-time care.
Yeah. Okay. Can I have some time to think and
Yes.
come back?
Definitely, you don't have to make this decision today.
Okay, thank you.
Thanks for coming back in today. Have you come to a decision on how to proceed going forward?
Yeah, after sitting and thinking about the time commitment and the cost and just how her quality of life will be affected, I don't know if I'm going to be able to do it.
Yes, and I think those are all very important factors that need to be part of your decision. And also, we don't know if it would come back. This is an aggressive form, and there is definitely a chance of reoccurrence.
Yeah.
And then we would just be having the same discussion later on.
Okay. I think after reviewing all the options, euthanasia is the best bet for both her and me.
I think that you've made a good decision.
Euthanasia is something that no pet owner wants to talk about, but unfortunately our pets will likely leave us within our lifetime. Therefore, it is important to prepare and plan for the situation. Hopefully these clips have helped you better understand and may help you better decide if euthanasia is the right decision to make.